Okay, good morning. I need to check a little bit of the technical glitches. We had some last time. Let me see here today. Okay. Hello? Hello, testing, testing. Hello? Testing, testing. Okay, looks like everything looks good from my end. If you have any problem, please send me your feedback. Okay, good morning again. I'm in a new place, so trying to be sure there is no technical glitches again today. If you have any, please send a comments or questions here. How do I go here? Anyway, I think it's working. Today is Saturday, November 20th, 2021. This is our regular scheduled yoga therapy class. And today's topic is another interesting topic. And this topic is from our experience. Today's topic is, let me be sure you are getting all the audio feedback. From our experience. Today's topic is, okay, I can hear it, so it's okay. Today's topic is pranayama instead of medicine. Wow, that's a radical title. But this is where it's telling from our experience. Now, let me tell you what our experience is before we start doing the practice session. We have been doing this yoga therapy program for a long, long time. A few years back, a person came to us, to our class. He was around 53, 54. I had a huge truncal obesity, diabetes, hypertension, coronary artery disease, had a swollen leg, arthritis. All looks like lifestyle-related disorder, a classic metabolic syndrome. He was on an 18 medication, and unfortunately, he was doing a private business, and he could not afford your health care anymore. So he lost his health insurance, came to our class, wanted to have some help. Because of his size, overweight, we let him sit down on a chair with his spine straight, eyes closed, do some relaxation, then practice first after a little relaxation, a pranayama, exhalation first, then exhalation longer than inhalation. Slowly progressed him to do a Kapalbhati Pranayama, just sitting on a chair and continuing as long as he can, as if it is his normal breathing, and then continue. Eventually, he got so help from these practices, he started extending his time. And at the end, he could do almost 1,500, 2,000 Kapalbhati Pranayama at a one sitting down. And almost all of his health, lifestyle related disorders were slowly and slowly being tapered out. He did not have any progression. He started seeing his doctors. Doctors started reducing his medication. Essentially, that pranayama became his medication. He's still continuing it daily. The first, he came and told me one day, I'm doing it. I did not have that much of a faith in doing it. But one day what I noticed, I was trying to put my belt on, and I see that my belt, the two holes has gone down. So my truncal obesity went down. That clicked me. Another lady, she came to our class with a multiple sclerosis. She had a multiple sclerosis on a multiple medication, but she also had asthma. She had asthma. She was taking the medication for last 20 years. As a part of our yoga therapy program, she was doing the pranayama, which we do a set of pranayama, which we'll show it to you again. And you have seen my pranayama classes. We do about 6 or 7 pranayamas routinely for daily practice. Within a pranayama practice, she said, within 3 to 6 months, so she doesn't have to take any more medication for her asthma. And also she had a little bit of chronic obstructive pulmonary disease. So it really struck us, and we have all these cases after cases. Another lady came with a hypertension. So we taught her how to do relaxation response, reduce her afterload, reduce her peripheral resistance, slowly continuing it. Next time she goes to the doctor, she said, yes, he started reducing my medication, antihypertensive medication. So I can go on and on and on, but basically you have to remember the basic physiological concept is almost all of our chronic lifestyle related disorders, the metabolic syndrome, is due to our stress. And the stress is nothing but a high sympathetic tone. And this high sympathetic tone gets counteracted with your relaxation response, activation of parasympathetic tone, which a good asana and pranayama practice does. As you know, the pranayama is the 4th limb of the 8 limbs of the yoga practice. Asana being the 3rd limb, and the asana which is needed for a pranayama practice is called sthiram, that means stillness. Sukham means happy. Asana is a posture. Basically, asana means a grounding posture. That means this posture, I'm sitting down, it have to be stillness, means there will be no fasciculation in my muscles. That is called sthiram. Sukham, I'm happy sitting like this. I'll be able to sit down like this for hours and hours. Because why? I've been practicing and I develop a neuroplasticity. My brain is allowing me to sit like this. So the basic asana practice is called sthiram sukham asanam. Every asana practice you do in a yoga therapy practice is like your savasana. Every asana will be a sthiram sukham asana. Then you do pranayama practice. Pranayama practice is very effective for chronic lifestyle-related disorders, and it prevents its progression. In some situation, it also regresses. So let's go ahead and start doing practices. And if you're doing it with me, so please. It's a very fun to do practice pranayama sitting in a chair. If you sit in a chair, sit down, but first component is keep your spine straight. The moment keep your spine straight, your relaxation response sets in. Because the muscles, back muscles called your erector spinal muscles. The muscles are tight to keep my spine straight. So I give some rest to this erector spinal muscle, so the muscle starts to relax. Initially, it's like feel like two stones. Now feel like two pillows, soft pillows here. Next, you do what's called a hand mudras. There's a lot of mudras. We'll be practicing the hand mudras with our pranayama. Breath is a connector between your body and mind. And hand also connected in body and mind. Our hand moves before you can talk. If you like something good, we say this. If we want something, we say this before you say, give it to me. And you'll see children's hands all done in mudras. There's a Dhanu Mudra, this is called a Vayu Mudra, there's a Shunya Mudra, there's a Prithvi Mudra, there's a Varun Mudra, Shakti Mudra, there's a Apana Mudra, Apana Vayu Mudra, Linga Mudra, Ganesh Mudra. So we'll do all the practices and I'll tell you the health benefit of every mudras. So I'm here sitting down. This is called your easy pose, Sukhasana. I put my feet underneath my knees, cross it in the middle, keep my spine straight. And also, after a while, I change my foot so I can activate both sides of my brain, create a balance. Touch my index finger and thumb. This is called a Dhanu Mudra, put it over my knees. The mind gets distracted with the five senses. I see, I hear, I smell, I taste, and I touch. The most important sense is your vision. So close your eyes. Spine straight, eyes closed, hands in a mudra, meditation mudra. The first practice is breathe out first. Why? Lung is like a balloon. It has 6 liter capacity. It only needs 1.5 liter to keep it open. 4.5 liter can be exchanged, which is called a vital capacity. Normally, in our regular breathing, it's called tidal volume. We only breathe 0.5 liter, 500 cc. So we have 80 to 90% reserve in our lung. So if you first take a deep breath in, it is sitting in the top of the lung, sitting in the top of this residual air, and that air is a non-functional. We call it a dead space. Breathe out first. Next, always breathe through your nostril. Do not breathe through your mouth. When you breathe through your nostril, when you breathe out through your nose, just practice with me. You will see what a difference it makes. Close your eyes. Visualize air is coming out through your nose. Then visualize air is entering from outside to your both the nostril. When the air is entering, visualize air is getting filtered in the nose. Nose is a powerful filter. So all the dirty airs which we are breathing, nose is taking care of them. Nose is like a personal air conditioner. Outside air is warm, it will cool it down, and outside air is cool, it will warm it up. Then the air goes on both the sides of the nostril where there is some channel called a turbinate. When the air goes through the turbinate, it creates a vortex. So in the vortex, when slides over the opening of the sinuses called mucosa, all the sinuses, maxillary sinus, frontal sinus, they all open in the nose. It secretes a substance called a nitric oxide. Nitric oxide is a very potent vasodilator. It opens the blood vessels, and nitric oxide is an activator of your parasympathetic tone. Cyclic GMP, acetylcholine, is the other substances which activates parasympathetic tone. Air gets then totally guided into the larynx, through trachea, into the lung. Goes to the upper part of the lung, middle part of the lung, lower part of the lung, almost goes to the level of your belly button. Then you can visualize air is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, coming out through your nostril. Breath that picks up prana. Prana is a life force. Prana is a subtle energy which keeps us awake, alert, and alive. Breath is not prana. Prana is like electricity, and breath is like the electric cable. Breath is the carrier of prana. Yogic tradition, our whole body does a breathing, not only lung. Our skin does breathing, liver is breathing, kidney is breathing. So you can visualize the prana is coming with the breath to the organ of healing. I have a heart problem, I visualize prana is coming to my heart to do a healing of my heart. If I have a back pain, I visualize prana is coming to my back and take care of my back pain. It's a wonderful practice to do from the nostril. And what we also do every morning after brushing our teeth, the tongue scraping, then we use the jal neti. We use a little pot called a neti pot, little lukewarm salt water. We wash both sides of the nostril to keep both the nose open. So both of our nostrils are open and a very comfortable breathing through your nostril. If you breathe in through your mouth, you have no idea where the air has gone in. We've gone to the lung, or gone to your stomach. When somebody really asks, I have to do the breathing through my mouth, what do you tell them? You can please breathe in through your nostril, breathe out through your mouth. There's a lot more physiological. Now let's practice exhalation longer than inhalation. Simply, you can breathe out first. Breathe in with a count of 2 in, 1 and 2 in. Breathe out with a count of 4 out, 1 and a 2 and a 3 and a 4. It has to be completely effortless. Effortless breathing means you can talk, you can even sing. And when you are doing this, a relaxation response sets in, parasympathetic activation takes place, and you can see my mouth, I'm having saliva in my mouth. My mouth is wet. I'm talking to you for some time, my mouth does not get dry. What happens when you get a sympathetic overdrive? Like when you have a fear, then your mouth becomes dry. Here my mouth is wet. Then the muscles of respiration are called skeletal muscle and they can be trainable. So keep on increasing the numbers and you keep on practicing where you are effortlessly. Keep practicing. Within few weeks, you will develop a habitual form, which is called a neuroplasticity. Brain will change and you'll be breathing like this even you are sleeping. So when you're sleeping, you're breathing. That's a function of your brain stem. This is a subconscious or unconscious brain. But when you awake and alert, you can still take a deep breath in and deep breath out. This is a function of the cerebral cortex. This is a conscious brain. So the brain connects between breath connects between your brainstem and the cerebral cortex. Connected between your conscious and subconscious, connected between your body and mind. Let's practice. We've been doing it for so long, we can do it 8 seconds in, 16 seconds out, 10 seconds in, 20 seconds out without any effort. So let me give you an example. So I'm going to show you 6 seconds in, 12 seconds out. I'll breathe out first. I'll breathe in 6 seconds in, 12 seconds out. Very easy for me because I've been doing it for so long. I'm still breathing, I'm still talking, I'm still smiling. So there is no effort in breathing, completely effortless breathing. Effort in breathing does not cause any healing. Effort in breathing many a time will create a hypoxia. That may be good for your building strength and stamina, but not for healing. Okay, let me do again, one more time. Let me show you 8 seconds in, 16 seconds out. Breathe out first. It's a wonderful experience. Exhalation longer than inhalation, preferably 1.5 to 2 times. I can feel in my capillary pulses that my sensation has gone down and I am feeling the sensation is going down. I have a little numbness and I feel a capillary pulsation. It's a wonderful, wonderful experience. Going against the grain of your habit is yoga practice. So your normal breathing is you see what is happening here. Okay. Your normal breathing is inhalation is active, exhalation is passive. Then you first also you try to remove the retained carbon dioxide actively and then also breathe in actively. Active inhalation, active exhalation, and it's called your bellows or Bastrika. It improves your lung function. But when you do abdominal breathing, like a belly breathing, you've seen the baby when the baby is sleeping. When they breathe in, abdominal wall will rise. When you breathe out, abdominal wall will go in. The abdominal breathing causes more relaxation. And thoracic, the chest, thoracic breathing causes better lung function. Now think about a scenario. Person who is dying. First we say person expired. That means his or her last breath will come out. When the last breath comes out, the lung stops. When the lung stops, then the heart stops. When the heart stops, then the brain stops. When the brain stops, the cellular function stops and person dies. So if you improve the lung function, heart function gets better, brain function gets better, and cellular function gets better. So improve the lung function with a pranayama. Pranayam. Prana is a life force. Yam is a control and restraint. You'll be doing it very slowly. People always ask me, am I doing a slow pranayam, rapid pranayam? No, you are doing a pranayama for healing, completely effortless. That means that pranayama practice is like your normal breathing. Remember, normal breathing. You will be able to talk, you'll be able to sing. There will be no effort in breathing. So a bellows will be, see, a bellows is used to blow your fireplace, or a blacksmith uses it. A lot of the people in the city has never seen a bellows. So bellows will be like, breathe in. So I do my eyes closed, the spine straight. Then I will also do balance. Like I will breathing in, breathing out. So now I'll be doing breathing in, breathing out equally. So it will be like this. A person who comes first time, person who has multiple medical issues, he or she may not be able to do it. So let them do it very gently and let them progress it. Bastrika Pranayama, bellows Pranayama improves the pulmonary function. It helps in most of the intrinsic pulmonary disease. Intrinsic means the disease of the lung, asthma, COPD, pulmonary fibrosis, pulmonary hypertension. You can name the diseases. So in that case, what we do, we raise our hand high up and slowly pull it down. And when you pull it down, we do a mudra called Adhi Mudra. See, this is very interesting. I want to show it to you. 3 mudras. Remember this mudra, when you're done, they call it Dhanu Mudra or Dhanu Mudra. So this mudra, touching index finger and thumb, and Dhanu Mudra, Dhanu Mudra, your palm is facing up. When you put your palm facing down, it is called a Chin Mudra, and it helps opening lower part of the lung. When you close the other fingers, this is called a Chinmayi Mudra. Chinmayi Mudra, it helps opening the middle part of the lung. Then you do like a baby fist. The way the baby does fist, put a thumb inside and close. This is called Adhi Mudra. and this Adhi Mudra opens the upper part of the lung. Children does this all the time. Children will cry, they'll open up lung. And also we think this is a mudra, children is asking, I need help. This became a sign of your social media now. Recently, there was a person who had been abducted, and he or she was in the car, and he or she was showing this sign from the car. So another car which was passing by saw the sign and knew this is a sign for I need help. And the car called 911. 911 found the car and found that person was being abducted. So we use this as a profound relaxation of our body and mind. So when you put our hands high up and then pull it down, we do it in a Adhi Mudra. So this will be at the beginning, you sit in a chair or sit in a ground, whatever your grounding posture, will be breathing out first. Take a deep breath in and slowly bring it down with Adhi Mudra. Breathe in. There is no hard and fast rule how many you need to do. You do it what your body will allow you to do. If you can do 10 of them, it's fine. Keep doing 10. Will you see in a couple of weeks you'll be able to do 15. And in a few weeks you'll be able to do 20. For our practice, what we do, we'll do the same, raising our hand. We'll do in a slow speed, a medium speed, and a rapid speed. We'll do 20 counts of slow, 20 counts of medium, 20 counts of fast. We make it like a one cycle. This is for the people like us who have been practicing for a long time. See, we'll be doing very faster pranayama practice, but what will happen, we are still completely effortless. Still completely as if it was our normal breathing technique. So let me show you the one cycle. And if you want to do with me, let's go ahead and do with me. We'll be slow 20. Very simple and easy. Then you do it at a medium pace, another 20. Finally, doing a rapid speed, another 20. This is one cycle, and you will feel the body is getting warm, and you also feel that your body has a symptoms and sensation of hyperventilation. You may have an altered sense of consciousness. You may feel like you are a little bit of a dizzy, you're drowsy. You'll have a circummoral numbness, numbness around your mouth, carpopedal spasm. Like there's a spasm in the hand and feet. Sometimes you feel a little, almost like a constriction in your throat. It's called globus. But these are all signs of hyperventilation syndrome, and if you can do it completely effortlessly, should not bother you or affect you. You will have some drainage because that we do in the morning. We do our jalneti, so we always have some. And keep on practicing. I practice it every day. Then what you can do, without raising your hand, you can do it very active Bastrika Pranayama. I can do it about hundreds and hundreds of them, but let me show you just a little simple example and you will understand. Active inhalation, active exhalation. Hand again in Dhanu Mudra. Yeah. You'll be surprised when you do this, all these contents comes out. Both the nostril opens up completely. I just did simple 50 of them. I can do it about 150, 200 without any effort in it. You can do a lot faster than that. But remember, when you do this fast pranayama, it has to be totally effortless. People always ask, oh, you should be careful about doing pranayama. Pranayama can do a lot of, yes, pranayama will do a lot of hurting when you don't follow your body's signal. If you listen to your body, do pranayama practice as if it is your normal breathing, you're not going to hurt yourself. Oh, look at this yogi and yogini, how fast are they doing? They've been doing because they've been doing probably when they were born, They call it born yogi. So in a faster pranayama, you will see, let me just give you a little example so you'll understand what I'm talking about. There's a faster Bastrika Pranayama. I did 250 of them. But I feel warm. I have a warmth inside, at least almost I'm perspiring. This is called work of breathing. Work of breathing is a tremendous amount of calorie you burn. You talk about cardiovascular fitness. You talk about your doing all these, exercises in the gymnasium, weight training, which I also do, but nothing like this. You can feel the effect of this to the body and mind. Practice daily, you will see you have a tremendous improvement in your lung function. You'll be able to breathe out. My lung is completely empty now. Let me take a deep breath in. I can breathe in almost maybe 3-4 times, maybe 5 times more than what I'm normally breathing in and breathing out. It drives away all the chronic lifestyle related disorders. That follows with a Kapalbhati Pranayama. Kapalbhati Pranayama is called Metabolic Pranayama. Bastrika Pranayama is called the Pradhan Pranayama. Prana is a life force, Pradhan is the main. That means Bastrika bellows, bringing prana to your body and mind for pranic healing. Wonderful experience. Kapalbhati Pranayama is called Kapalbhati. Kapal is a forehead, Bhati is a shining, called forehead shining pranayama. There is a balloon in abdominal cavity. There is a diaphragm here. There is a balloon in the lung. You push your abdominal cavity inside, bring your awareness to the belly button, push it in. It will hit the diaphragm, then hit the lung, and all the air will come out through your nostril. You don't breathe in. It's an active exhalation without inhalation. You breathe in between without knowing. Why? Because that's the way you started breathing. The day you were born, you took a deep breath in. Nobody told you how to breathe in. You have to learn how to breathe out, not to breathe in. It removes all the toxins from your body. It helps igniting your digestive fire. It's called Agni, Jathar Agni. It improves your tejas, the fire within you. If you keep on doing this pranayama, you will see, people will say you are glowing. There is a glow around your face. That glowing is described as a Kapalbhati. Kapal is a forehead, Bhati is a shining. You'll say there is a light around your face, around your forehead. We make a joke all the time with our frontal baldness. So there's a light reflects from here. There's a reflector. So we use the mudras. General 10 mudras. This is called Dhanu Mudra, Jnana Mudra. It quiets down our mind. It also balances our pitta dosha, our mind, body type. Put index finger down. This is called a Vayu Mudra. It balances your vata. Middle finger and thumb, this is called a Shunda Mudra, or infinite Mudra. This improves your hearing. Touch your ring finger and thumb, this is called Prithvi Mudra, or Mudra of your earth. Grounding, it balances your kapha dosha, very effective for your diabetes and truncal obesity. Little finger and thumb is called your Varun Mudra. It helps balancing the water in your body. It helps controlling your bladder function. Very effective for your skin condition, cardiovascular system. Touch your ring finger, little finger, and thumb. This is called a Shakti Mudra or strength. Wake up in the morning, you feel you don't have enough strength, do this mudra called a Shakti Mudra. Shakti means strength. Middle finger, ring finger, and thumb is called a Apana Mudra. This is called a Pachan Mudra, called a Digestion Mudra, and it is a downward cleansing for your body and mind. Any excess in the body which causing a dis-ease, this Apana Mudra helps. If you put index finger down, this is called Apna Vayu Mudra, or this is also called a Hriday Mudra. Hriday Mudra, it helps improving your cardiopulmonary function, heart function and lung function. It's a tremendous amount of mudra, but say if you put your hands together, it's a Linga Mudra. Linga Mudra helps improving your body heat and helps in removing your phlegma. You'll see children's doing a hand like this as a Linga Mudra. This is a Vayana Mudra. This is your Udana Mudra. This is your Ganesh Mudra. This is called a Hakini Mudra. This is called your Shankha Mudra. This is your Dhanu Mudra, touching alternate fingers. So all the mudras, what you do, mudras helps mudras are a neuropsychiatric connector for the prana to go to the organ of healing. So we do the mudras with the pranayama. Generally the 10 mudras, and we do about 50 Kapalbhati Pranayama. So let's do maybe 10 or 20 with each mudras to show you the practice. I'll tell you the benefit of this, and if you want to do with me, do that. This is called your Agni Pradhan Pranayam. Agni means your digestive fire. It ignites your digestive fire, Agni Pradhan Pranayam, and it's also called a Metabolic Pranayam. It helps in all the metabolic disorders of our body. So again, sit down with a grounding pose in a chair with the spine straight, eyes closed, touch your index finger and thumb, bring your awareness to your belly button and push the belly button to the back. Somebody new in practice, what you could do, you can put your hand in your belly button and hand under your nose. You'll see air will come out when you push your belly button in. And nothing moves. Here, hits the diaphragm, hits the lung, air comes out. Then what you can also do, you practice, see, patency of your nostril. You will always see one nose is always more open than the other. And it's a cyclic, goes throughout the whole day between 90 minutes to 2 hours period. It alternates between which side is more open and better flow. So I'm testing it. Closing my right nostril, I'm seeing my left nostril breathing. Perfect. Completely clear air comes out. Then I'll be doing breathing in and out. My left nostril is completely open. Let me try with the right nostril first. My right nostril is open too. You can practice yours and see which side is more open than the other. And I'm breathing from my right side. Both sides are equally open. Another way you can see, let me show it to you, that if when you look at your nostril, this ella, both of them will open and move at the same time. Let me show it to you so you'll understand what I'm talking about. See, both these are equally moving, but when you look on yours, take a look at it. One side may be moving more than the other because one nostril is closed. So this is the call. Yoga is your practicing yourself, self-discipline, self-realization, self-reflection. You can feel it in. So let's do a practice. Touch your hand. Dhanu Mudra, 20 of them. Very slow, no rush, 1 per second, and continue with me if you're doing it. Vayu Mudra. Continue that with me. Let me tell you the benefit of this mudra. It massages the abdominal content, massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your colon, massages your small intestine, massages your rectum. For the men, massages your prostate. For women, massages your ovaries, massages your tubes, massages your uterus. And when they massage the organ, the function of the organ gets better and better. Shunya Mudra, it also massages your diaphragm. Above the diaphragm, both sides of the lung, it massages your lung. So all the air comes out from the lungs, so all the toxic air comes out, so it is called a metabolic pranayama. Varun Mudra, touch little finger and thumb. In between the lung is the heart. It's massaging your heart. Massaging your heart very gently. When you massage your heart, the heart function gets better. When people have a cardiac arrest, when you could not be resuscitated with compression of the chest, it's called the CPR, cardiopulmonary resuscitation. Basically, you're massaging the heart. Many of the time in the emergency room, we used to do a very urgent left thoracotomy. Open the chest on the left side, hold the heart, and massage it manually to bring the function back. It's massaging from inside. It's like internal CPR. Shakti Mudra, little finger, ring finger, and thumb. Apna Mudra, middle finger, ring finger, and thumb. See, I'm having some saliva in my mouth. Even after talking to you over an hour, I'm still having mouth is still wet. You can continue all the mudras. So what happens when you do the mudras, you get a double benefit. The vagus nerve, which comes after the origin of the brain stem, It has its path on both sides. I've described it before. The left one comes in the front of the gastroesophageal junction, and the right one comes behind. So when you do this Kapalbhati Pranayama, the vagus nerve get stimulated. After that, what you practice is called your breath holding in exhalation, which is called your abdominal lock. We also do the breath holding in inhalation with the chin lock, which is called a Murcha Pranayama. Then you move our abdominal wall back and forth, which is called Agni Sarkriya. These are all your relaxation response and metabolic pranayama. So Uddiyani Bandh, or abdominal lock, you breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. When you do proper pranayama practice, you get this cough, because cough originates in your larynx, in a vocal cord. Just a physician was talking to me. She had a spasmodic dysphonia. That means vocal cord is in a spasm, and her voice was getting a problem in talking. So exercising the vocal cord, which I'll show it to you in Ujjayi Pranayama. So this Uddiyani Bandh is also called a Vajra Pranayam. It's a breath holding and exhalation. It increases the negative intra-abdominal pressure. It helps in proper perfusion of the intra-abdominal organs. So all the disease, which is the liver disease, kidney disease, it helps in a better perfusion. Since it creates a negative intra-abdominal pressure, we also recommend this to people with hernia, because hernia pushes down with a positive intra-abdominal pressure. It creates a negative intra-abdominal pressure. You do a Agni Sarkriya, you do a Kapalbhati Pranayama, you do your abdominal lock, Uddiyani Bandh, and then use the abdominal wall to massage all the internal organs. Wonderful practice for diabetes, because it massages the pancreas. So what you're doing, you're holding the pancreas, literally squeezing it to get the insulin out. So let me show you to one Agni Sarkriya. Breathe out first. Take a deep breath in. You could see it's only your abdominal wall will be moving. You suck your stomach in, then you will move your abdominal wall. Continue a few times. And for people like us who've been practicing daily, we never leave home without doing this abdominal lock, Uddiyani Bandh, and Agnisar Kriya. Between those two, I generally do it about 7 to 10, maybe 4 each, maybe 8 or 5, another 4. We also practice the breath holding, and the way to do the breath holding, you breathe out first, take a deep breath in, hold your breath, then slowly drop your chin down, touch your chin down to touch your chest. When you hold your breath, the air inside the lung, because of the diffusion, gets more and more, the lung starts to expand. When lung starts to expand, it comes up to your rib cage and it cannot expand anymore. Then body has a reflex, which is called a Herring-Brewer reflex, by which it started collapsing the lung so it cannot extend anymore. That Herring-Brewer reflex activates through your vagus nerve. And vagus is the activator of your parasympathetic tone. So wonderful relaxation. Then also it helps diffusion of the oxygen to the blood. It's almost act like your PIP, like a positive end expiratory pressure, which you use in our respirator. Chin lock activates your carotid sinus. It massages your carotid sinuses and relaxation response sets in. So let me show you how to do it. It is so relaxing. It is called a Murcha Pranayama. Murcha means almost unconscious. I'm showing you the technique. Generally, we do it 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. So if you can do it, you do about 5 to 10 minutes of Kapalbhati Pranayama, 2 to 3 minutes of Bastrika Pranayama. Then we'll show you it called Anulom Vilom Pranayama, alternate nostril breathing, another 5 to 10 minutes. The breath holding in inhalation. Breathe out first. Take a deep breath in. Hold your breath. Slowly drop your chin down, touch your chin to the chest, and keep counting. 1 and 2. See how long you can hold your breath. It is such a relaxation response. A lot of people practice it before going to bed. Murcha Pranayama. All of our disease is created because of the imbalance in our brain. We're lateralist. I'm right-handed, right-footed. I'm left-handed, left-footed. I'm not using. You have to activate both sides of your brain. Alternate nostril breathing activates both sides of your brain. Wonderful, wonderful therapy for people with hypertension, cardiovascular disease, water-related disorder, neuropsychiatric disorder. Also helps improving your memory. So it helps people with your dementia, Alzheimer's disease. Dhanu Mudra, index finger and thumb over your left knee. Right hand, close your right nostril. You don't have to close all the way down, just close it just underneath your nostril. Breathe out through your left nostril. Then breathe in through your left nostril. Close your left nostril, breathe out through your right nostril. Exhalation longer than inhalation. Breathe in through your right nostril. Close your right nostril, breathe out through your left nostril. Keep doing it. Let me tell you the benefit of this pranayama. Left nostril is controlled by the right brain. The right brain is intuitive. Right brain is female. Right brain is relaxing. Right brain is parasympathetic. Left nostril breathing is called a moon energy, Chandra Nadi, parasympathetic, relaxing. Right nostril is controlled by your left brain. Left brain is analytical. Left brain is male. Left brain is heating. Left brain is sympathetic. Right nostril breathing is called Suranadi, sun energy, sympathetic. It activates both sides of your brain. Continue doing it as long as you can do without any effort. And if you can do it for 5 to 10 minutes, it'll be great. Eventually, put your index finger and middle finger in between eyebrows, the third eye. Then with your left hand, hold your right earlobe. This is called your super brain yoga. It balances both sides of your brain. Close your eyes, bring your focus into your third eye, and continue doing alternate nostril breathing. Neuropsychiatric disorders, cardiovascular disorders, water-related disorder, and bring the focus back between your memory, between dementia and Alzheimer's disease. It's a wonderful practice. We do this 3 major pranayama: Bastrika, Kapalbhati, and Anulom Vilom Pranayama. Bellows, breath of fire, and alternate nostril breathing. Next we do, quite down your brain, is called your Brahmary Pranayama or Bumblebee breathing. In yoga, the mind is the content of your 5 senses. I hear, I see, I smell, I taste, and I touch. Shut down our 5 senses, then you create a vibration. Our brain is in a state of vibration. 2 vibration interacts, cancels. It's called your harmonic resonance. Mind quiets down. So wonderful pranayama for insomnia. And people are taking your sleeping pill and medication. After doing this pranayama, most of their sleeping pill use goes down. So this is a pranayama instead of medicine. Index finger in the forehead, third eye, 3 fingers to close your eyes. You can also use a Shanmukhi Mudra to close. Thumb to close your ear and close your mouth. You'll be all doing through your nose. Breathe out first. Breathe in through your nose. Breathe out the sound of a bumblebee. With the pumping and cupping, keep your hands, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, take the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand, then massage your forehead, massage your eyes, massage your face, massage your ear, earlobe, behind the ear, in front of the ear, inside the ear canal. Bring a hand and massage, side of your neck. It is your carotid sinuses massage, because relaxation. Take your hand and massage your back of your neck, insertion of your trapezius muscle, sternomastoid muscle. Both are supplied by cranial nerve. For therapeutic purposes, when you do for insomnia and other cardiovascular or neurological disorders, we generally practice between 5 to 7 to 10 of this bumblebee breathing. Most of the disease, chronic neurological or chronic lifestyle-related disorder, is due to our insomnia and sleep apnea. Insomnia and sleep apnea activates your limbic system. The nuclei amygdala and hippocampus sends a signal to hypothalamus, pituitary gland, cortisol level goes up, sympathetic discharge goes high up, creates all the disorder, starts creating your truncal obesity, which causes pro-inflammatory molecule. Inflammation causes your diabetes, hypertension, and coronary artery disease. For sleep apnea, you slowly constrict your larynx. Try to breathe in and out. It's a very relaxation. Larynx is supplied by both superior and inferior laryngeal nerve, and they're a branch of the vagus nerve, and the vagus nerve gets activated. The vagus, 80% is the afferent. That means it's going to the brain. Generally, it goes to your brain stem. For the brain stem, the signal comes out. First comes out the glossopharyngeal nerve and the cranial nerve, which supplies your soft palate. There are two muscles called palatopharyngeus and palatoglossus. They get tightened up and your snoring goes away. There is an operation for snoring. It's called UVPP, uvulopalatopharyngoplasty. Generally, that tightens up those muscles. It also supplies, a nerve comes out, so-called a hypoglossal nerve, which supplies your tongue, pushes the tongue in front. So it also helps reducing your sleep apnea. Ujjayi Pranayam, you incorporate with, it is so relaxing, and you incorporate with your Udyani Bandh. You'll see abdominal wall will go in. Then you do a Jalandhar Bandh chin lock. And after chin lock, you do your left nostril breathing. So Ujjayi Pranayam is relaxation. Chin lock is a relaxation. Left nostril breathing is all relaxation. There is parasympathetic activation. Let me show you one time so you'll understand. Close your eyes. Initially, you do both breathing in and out, and it brings a tremendous amount of focus. People are playing golf. They're trying to hit the ball at the golf. They cannot. Move their thigh, they cannot. So I said, why don't you let go? Do some Ujjayi Pranayam, then hit the ball. You'll see you'll be able to hit the ball. So when you slowly constrict your larynx, Ujjayi Pranayam will sound like a sound of an ocean. Therapeutically, when you tighten up a little bit more the larynx, it will sound like this. Again, when you're getting cough, that means you're hitting the right place for your Ujjayi Pranayama. Let me show you a whole Ujjayi Pranayama with a chin lock and Chandravedi Pranayama or left nostril breathing. tremendous relaxation response for any kind of neuropsychiatric disorders, cardiovascular disorders. Breathe out first. Take a deep breath in. There cannot be any better practice than this. Practice this, you will see the effect of it in your body and mind. As you said, you always breathe through your nose. We do not breathe through our mouth. But you do some breathing through our mouth for our using the power of your mouth to cause your cooling down inside our body and mind. So you call it Sitali Pranayama or Sitkari Pranayama. Sitali Pranayama means cooling. It's very effective for people with pitta disorder, cardiovascular disease, gastroesophageal reflux, women with your hot flashes. It's a wonderful practice. Generally, the way you do it is that you stick your tongue out, roll your tongue, breathe through your rolled tongue, and breathe out through your nostril. In a short time, you get a completely inner side gets cool. You see also I put my finger in between my toes are relaxed, hands are relaxed, my whole body is relaxed when I'm doing it. If you cannot stick your tongue out, you can do through your teeth. It's called a Sitkari Pranayama. Lot of other pranayamas, the Savitri Pranayama, where you do practice your breath holding. Breath holding, when you inhale, is called inhalation. In Sanskrit, it's called the purak. When you breath hold, it's called the kumbhak. Abhantarin kumbhak, or called a retention. Then you exhale, it's called exhalation, it's called rechaka. And breath holding after exhalation is called your bajju kumbhak, or it's called a suspension. Plavani Pranayam, you can take a deep breath in, fill up your stomach, and it's as if you're floating. Shankha Pranayam is the one which helps your building your lung. It's a resistive exhalation. Ujjayi Pranayam, this is called resistive inhalation. You are inhaling against the resistance. So you do your Adhi Mudra, put one in the top. You breathe out through your nose. Take a deep breath in through your nose and breathe out through your mouth against resistance, as if blowing a conch shell. One more time. Very good for intrinsic pulmonary diseases. Let's finish with a last pranayama, which is always called a chanting pranayama, Om pranayama. Also, you can do a Pranava pranayama. Pranava pranayama is a better. Let's finish with the Pranava pranayama. Om has a three component: A, U, Ma, A, U, M. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. You do the Chin Mudra for your lower part of the lung. You do Chinmay Mudra for middle part of the lung, and do Adhi Mudra for your upper part of the lung. So do Chin Mudra, touch your index finger and thumb, put your hands palm facing down. Breathe out first. Take a deep breath in and breathe out with the sound of a ah. Chinmay Mudra, Om. Then Adhi Mudra, do Ma again, breathe out through your nostril, breathe in, and breathe out with the sound of a Ma. Slowly bring your hands in front of your heart chakra. Touch your little finger and thumb. Separate your ring finger, middle finger, and index finger. Padma Mudra connects your body, mind, and spirit. Slowly take the Padma Mudra close to your heart. Heart is the site of the soul. All the pranayama has a physiological changes in your body, which are exactly the same effect of the medications you take for your chronic lifestyle-related disorders, including aspirin, statin, beta blocker, ACE inhibitor. We can show you exactly the physiological effect which counteracts the action of the medication. That is the reason the topic is pranayama instead of medication, and we have hundreds and hundreds of examples. We have years and years of experience. We have years of experience, including myself. A day. Open heart surgery, triple vessel coronary bypass, 21 years back. I've not touched the medication in the last 15 years. Thank you. And also you can finish it last again, which is called thumbing and cupping. Rub your hands. When you feel the warmth in your hand, you're wearing glasses, remove your glasses. Put your hands over your eyes. Let the eyes take all the heat from your hand. Slowly massage your forehead, massage your eyes, massage your face, massage your earlobe, behind the ear, in front of the ear, inside your ear. Slowly bring your hand, massage your carotid sinuses and the back, insertion of the trapezius and sternomastoid muscle, which are supplied by cranial nerve. Wonderful practice. Both the nostrils are completely open, and it will remain open throughout the whole day, and will enjoy a wonderful day ahead of us. Thank you for joining. And next weekend is our Thanksgiving weekend. We'll have a good time with our families. So we're not going to have a class next weekend, and we'll come back probably the week after. But now is between the holiday starting Thanksgiving and Christmas. Probably are going to miss a lot of classes. But again, you keep on doing it at home, and probably we'll continue as long as we can, but definitely we'll continue a regular practice after our New Year's, after the vacation is over. Okay? Thank you for joining.